Currently, if we get a trauma patient that has neurosurgery needs, we cannot treat them here at Penn Presbyterian. We have to transfer them to the Hospital University of Pennsylvania. But come July 2014, we will be able to treat neurosurgery patients, and their care will be increased because they won't have to travel over to the Hospital University of Pennsylvania.
The transition of Penn Medicine's trauma center to Penn Presbyterian greatly enhances the ability for us to provide care on this campus for all injured patient populations, including the neuro-injured, the orthopedically injured, and numerous other kinds of patients that will be coming to Penn Presbyterian.
We're very excited about the entire project. The Acute Care Pavilion is going to be a wonderful addition to PPMC and Penn Medicine. We're particularly excited about the expanded emergency department, the new trauma bay, which will allow us to take care of 5 patients simultaneously, the 2 new surgical intensive care units, and the expanded operating room capacity. We're also excited about the new helipad.
The University of Pennsylvania and its health system has a far reach. We actually have strategically placed 6 helicopters throughout southeastern and eastern Pennsylvania. It's fairly routine for us to actually transfer patients by that helicopter program from as far away as Binghamton and Elmira, New York, to the middle of Pennsylvania, down through Maryland, throughout Delaware. And so we service a 5-state region on a routine basis. And once again, I would emphasize that these are patients that actually hospitals are dealing with, and they're struggling to find out what's wrong, or they've reached what we think are the most of their resources, and they need supplemental resources. So both the University of Pennsylvania and our hospital, as well as the flight program, really serves as a rescue hospital and a rescue flight program. All of us are very, very excited about the opportunities that the Acute Care Pavilion at the Presbyterian Medical Center are going to provide. That Acute Care Pavilion actually is an expansion of the capabilities here at the hospital of the University of Pennsylvania. This is not a new concept. We've actually looked at this concept for over a decade, and it's, as I said, very exciting that we're doing that now. We will be expanding emergency medical services, the emergency department, the trauma center and trauma receiving area known as the trauma resuscitation area. But more importantly, we'll be expanding operating rooms, specially designed critical care units, not just for trauma, but for other specialties too. And the way I look at this is that I think what this does is it takes the capacity of Penn Medicine and it opens it up and it expands it to a greater community and to the needs of the community.
You know, Philadelphia is one of the major metropolitan cities in the U.S., yet we don't have a single freestanding level 1 trauma center that is really the regional center. And from my perspective, everything, any injury, trauma, fracture, motor vehicle, fall from height should come to this freestanding level 1 advanced care trauma center that really is going to be the best in the region.
Well, I think it's important to understand that we have 3 great hospitals in our urban system here at the University of Pennsylvania. We have Hupp, we've got Penn State, we've got Presby. And maximizing how we utilize that to the betterment of both the health system and the people we serve is an important part of that. And I think that this first really big move of building a new trauma center and a building of critical care, for both neuro and cardiac here at Presby is a really exciting part of that.
The Trauma Center's transition to Presbyterian is part of a broader strategy of expanding clinical services across all of the campuses in the health system.
The benefits to going to Presbyterian is that all of that will be in one tower, that we'll be able to go right up in an elevator from the emergency department, the trauma bay, to the operating room, to the patient care. So it's all one area that we're traveling through to make it more convenient and make it better access for the patients.
The nurses were completely involved with the development of the entire perioperative area, and the best part is the holding area and the post-anesthesia care unit, because it's now one big unit and it flows naturally for the patient, and it provides individual bays for each patient, and the nurses design it ergonomically so that they can take care of the patients quickly and efficiently.
Trauma is a 24/7 type of service. So when you bring a service like that into a hospital, everything changes, and you have access to all kinds of types of care that you don't normally do, including neurosurgery, getting scans in the middle of the night if you need them, getting an emergent surgery consult in the middle of the night. or even just bringing a patient into the OR. You don't have to call in the operating room team. The operating room team is always there.
Penn Presbyterian for decades has been a tertiary referral center for patients with critical illnesses, in particular critical cardiac illnesses. This new unit will bring not only a physical infrastructure, but a medical infrastructure to continue to enhance that role for Presbyterian. So it will bring trauma with 24/7 in-house anesthesia and critical care physicians and trauma physicians. It'll bring neurosurgery, much higher intensity lab facilities, higher intensity and more sophisticated radiologic facilities. All those things will allow Presbyterian to continue to play a role as a regional critical care center, getting patients from 100 miles away, and actually catapult it into a whole new level of tertiary care.
Brain injuries are the leading cause of death in trauma patients. Penn Presbyterian just hasn't focused around urgent care, except in the area of cardiology, as a center at all. This is going to really dramatically change that campus and how people think of Penn Presbyterian in ways that are hard to imagine right now. But I can see a future where that is a leading trauma center throughout the entire region, where people come there for non-urgent care because they know the most sophisticated individuals are dealing with the most complex problems, so they want to go to that center. I think it's going to have a lot of a big halo effect. I think the trauma program moving to Penn Presbyterian, along with a neurosurgical program, is going to have a big halo effect for that medical center. It's going to bring a whole group of patients they don't presently have, all the trauma patients, but as a result, the other services, orthopedics, neurosurgery, critical care and neurocritical care, neurology, are all going to have enhanced presences as a result of the trauma program being there, because trauma involves so many different programs, and each of these services is going to have its own patient base. So I think we'll see a big change in that hospital.
You know, the modern trauma center has been renamed the Safety Net Hospital, and the reason that has come about is because when one looks at certain emergencies, one understands that they're time dependent. A safety net hospital, whether it be a rescue hospital for a heart incident or a brain incident or a trauma patient, actually guarantees that the resources are there the minute you need them. We'll have the ability and the expanded ability to reach out to patients at the moment they need it. And it doesn't matter whether they're having some type of a heart event or a brain emergency, they're injured, or hospitals just can't figure out what's wrong and they need additional resources to help in that patient's disease. The expansion and the extent of the safety net then benefits all of the communities and the people that live within it.
We all find it a very exciting time for Penn Presbyterian, and we believe that will open a new era in the history of Penn Presbyterian Medical Center.
It's exciting because you get to lay the foundation for things exactly how you want them, not how somebody else decided to do it or anybody else's vision. It's our vision. And so we're actually getting to take something from the ground up, which is challenging, but it's a tremendous opportunity for us.